it is necessary you include something more that is very, very important.
Okay.
We thought maybe I could just go and edit it from that place, from that heart part. Maybe 90. Okay, maybe it is here. Okay. Not okay. Yeah, here. 91. I mean, it is 90. And some social some association operational. No, 91.
Auricle.
Ventricle. It is 91, right? I told you what is catheterization is, right?
Yes, yeah.
So, but now, what I want to just add some things to it. It is simple and precise. What you need to just tell the teacher, because I remember that when we did this one, I told you everything about the heart, the direction, but it is also important for you to remember about this thing. If they say auricle, right auricle and right ventricle, it means they are talking about only this part here.
Atrium.
Atrium and ventricle.
Yes.
Both of them. How can we get into this? The main reason, indication
is
indication for catheterization. The right atrium or auricle and ventricle. One in determination. These are the definitive answer why we have to do this. You understand? And determination of the pulmonary blood pressure. Especially in the case of pulmonary hypertension. Pulmonary hypertension. Don't worry about the speed. You understand? I want you to understand everyone that we do clearly. You understand?
Yes.
If you know about this, about the right, then the problem about the left is nothing. You understand?
You can do same thing.
Yes. Same thing. Yeah. But what's the main route of getting into that route may just be different. See what I am talking about. You remember that here, this is if you want to enter here through catheterization, note one thing: we don't enter with catheterization. It is when we put catheter into blood vessels.
Yes.
If we want to use this, if we want to put this valve into the blood vessel, note we put only into veins.
Rubber only into veins.
Vein catheterization.
Not happen for artery,
right,
only for vein.
Right, left, any one catheterization only two veins.
Two veins.
So now I'm going to list also which veins that we will use.
Which veins?
But don't forget that point. We use only vein in catheterization of the heart. Or
why
of
you
the
use
you will
only
see
vein?
everything. You will see everything.
But
okay. Let's just continue. I will take them on. But I remember that we were talking about it, but I just gave general overview about everything. Yeah. But in the case where they ask you about right, it is you know the reason. In the case where you're asking about the left, you know the reason. You understand?
Okay.
But and I will tell you why. Determination of the pulmonary blood pressure, then I put especially in the case of pulmonary hypertension. Because many things, if I check your blood vessels, if I check your blood pressure now, this pressure that I check, it is of the left ventricle.
Left ventricle.
Yeah, for everybody it is of the left ventricle, but not many people talk about right ventricle, right atrium. Blood pressure, what is the normal blood pressure if you remember?
120/80.
Okay, and so normal blood pressure, they will tell, maybe you can remember this one someday. Normal blood pressure is supposed to be less than normal, the best one, less than 80 and less than 120. This is optimum.
Optimum.
But somebody that is having between sorry, you know this one is systolic, right?
Systolic over diastolic, yeah.
And this one is diastolic. So but now somebody can have between, let me just give you optimum BP equals to systolic, diastolic. This one you will use it everywhere. So for systolic, if it is optimum, it should be less than 80 millimeter of mercury. It should be less than 80. You understand?
80
millimeter of mercury.
It's not less than 80 for systolic.
80. Less than 120. Sorry, less than 120, and this for diastolic less than 80. Now,
what does mean optimum?
The best.
The best one.
Normal blood pressure of the systole is going to be between I put 120 here, right? Less than 120. It's going to be between 120 and 125, and this one is going to be between 80 and 85. Then there are 3 stages of hypertension.
Yeah.
First stage, that one is going to be between, maybe it is going to be 130, maybe 130 to 140. You understand? This one is pre-systolic. And then second stage is going to be between 140 and 160. And then this one is going to be I think I'm getting it wrong. I put 120 here, right? 120 to 140, 140 to 160, 160 to 180. Sorry. And then this one is 140, and then this one is 120. All right, and then this one is 160. So now for third stage of hypertension, it is greater than 180.
Greater than 180.
So it is correct now, but 120 to 140, 140 to 160, 160 to 180, then more than 180. This is the highest, it cannot go back again. Okay, and then here we are going to have between 85 and 90, between 90 and 100. Okay, let me just put 90 here, and then this one is between 90 and 100, and then this one is going to be 100 to 110, and then this one is more than 110. It is the best classification of hypertension, the gold standard. Okay. But now you see, when we talk about all this blood pressure, it is of the left ventricle.
For left ventricle.
This is what everybody talk about. But now if you want to check what is the blood pressure in the right atrium, the right ventricle, this is what you do. This is what you will do to check. The gold standard. You understand it?
Okay.
Gold standard for checking. Now, so if you give this question, if you are giving this question, you want to answer catheterization of the right auricle and right ventricle is the gold standard for measuring the blood pressure of the right ventricle.
And this the indication is used for checking blood pressure?
It is for diagnosis and for treatment.
For diagnosis
and for it's for diagnosis and for examination. You understand? Now, why did I say that? Is because now in the situation whereby there is probably, let's assume that there is blockage of the blood vessel anywhere, blockage of the blood vessel that is along the pulmonary arteries. And so if there's going to be that tube, that catheter is something that is like this. It's very thin, very small. You don't want to put it in blood vessel, so it should not be something that is thick. You understand?
Yeah.
But on top of it, there's going to be some small balloon. You know,
balloon. Yeah.
We will put it, but this balloon we will not inflate it. We will not put air.
Yeah.
Inflate. So at the end of here, there's going to be something that we can. You understand? And so this one is very small. We put it into the blood vessels, but I'm going to give you the places where we can put the puncture. Only very few places. We can use the neck, we can use the chest vein, and we can use the femoral vein. These are the main three.
I mean, so from femoral vein it go to other place.
These are the main three vessels that they use. Some people, excuse me, most people use the femoral vein.
Femoral vein.
But you can use the jugular vein, internal jugular vein. You can use the subclavian vein. You can use the superior vena cava.
Okay.
You understand this?
Yeah.
These are the main. So now, what they do, if you put it in the superior vena cava, let's take for instance superior vena cava, and you remember that superior vena cava opens into the heart, right?
Yes.
Into the what? Right atrium.
Oh yeah.
Right atrium, and you know that also right atrium opens into the right ventricle.
Right. Yes.
You remember, right?
Yeah, from reading.
Right ventricle, and then if now you put it here, you put the catheter here, you can trace it and it will enter into the ventricle.
Yes.
At this time, when it is in the ventricle, you can check. No, here it is also connected to a specific parameter that will show the 500, 400, 300, 200. Okay, I want to make it like 500, 400, 300, 200. Let me say 200 here. See, 100. So there's going to be this thing that is going to be showing as this thing is moving. When the top of it, when it gets here, maybe the pressure is going to be 10 millimeter of mercury. But when it gets here, because here the pressure is higher, so it can go to between like 10 to 12 millimeter of mercury. At this point, we will say the pressure in the right ventricle is this.
Yes.
We can use it to check the pressure in this place. It is very, very definitive. Also, it can continue, and you know that in the right ventricle, there is what valve from the right ventricle?
Right ventricle, we have no. For the right ventricle, tricuspid valve, no.
Not about the valve, but the vessel, the trunk, pulmonary trunk.
It go to the lung to get oxygenate blood.
Pulmonary trunk is in the right atrium, ventricle.
Yeah.
So then it can enter into the pulmonary trunk. You understand?
Yeah.
When it is inside the pulmonary trunk, the blood pressure can reduce a bit. You understand? But still, it can continue like this also until it's going to. You remember that pulmonary trunk at some point is going to divide into two, right? Into left and right.
Yeah. For lungs.
So by the time it gets to this place, you understand, it may not be able to move again.
Because it cannot go to.
Yeah. So now you can now press here, so that this thing is going to become inflated.
It became big.
Yes. It becomes. So now it means that blood that is coming from here will not be able to pass again.
Yes.
It is sure, right? It is
Yes.
clear. Because of that, now all the pressure of this blood will be pressing that balloon. You press the balloon. As it is pressing the balloon, it will be showing here how much pressure it is putting on the balloon. And then you'll be able to know, okay, this is the pressure that is present in this place.
So it tell you pressure about here. What about
the pulmonary vessels? No, it is the pressure here that is more important, because it is the one that is coming here that you define.
So it will tell you the pressure of here, of pulmonary vein.
Yeah, pulmonary pressure. Yeah, blood pressure. So now, in case when it is now maybe more than 25, you can say there is pulmonary hypertension.
It is more than 25.
So it is the usual condition where it is what they use to check the pulmonary blood pressure.
That's the indication.
The main indication is to check in the case of pulmonary hypertension, to check the pulmonary blood pressure.
But Master, why we check pulmonary hypertension?
Why we check the systemic hypertension?
To know blood pressure.
So it cannot be to know how much
But
food you
but
eat.
Mansur, for artery we use only the one for hand, main artery here, radial artery. We check only, yeah. But for if you check for venous only, we use this catheterization.
If you put inside artery, if you think by yourself, if you put inside artery, which artery would you use? Let's think together.
I don't know.
Okay, yeah, but if you put inside artery, you should remember that if artery, we have large, medium, small arterioles. We have veins, large veins. From your hand here, vein that is here is big than one that is here. This one is big than one that is here. This one is big than how you come from outside. It is easy for you to put something from here because it will be going easily because something inside after is bigger.
It became bigger.
You have artery like this, big, it becomes small, it becomes small. I mean, you have small, you have artery now. It is from the heart. It is
It's big because aorta.
From the heart it is big. Yes, from the heart it is big, right? Yeah, from the aorta it is big. Thoracic aorta, abdominal aorta, it is getting smaller and smaller. But what you need to remember, this place is big, right?
Yeah.
Pressure here is high because a lot of blood is coming from here.
Yes.
Now see, this place is small, and then you put something to block this one. How will you be able to get here? You're going to see this.
You already block.
Yes, so you cannot see what is the real pressure of this artery. And by the way, you have left ventricle that is pumping very actively, that you have regions on the chest where you can check the blood pressure. So it is very better for you to check blood pressure in some specific region, such as the radial artery, such as the cubital artery. You understand what I'm saying? Like in here, you understand? You can easily
Cubic
check.
artery. Where is cubic artery?
Cubital.
Cubita. Okay.
Okay, and so you can easily check in this region. You don't need to enter into the heart for you to check this pressure.
Yeah.
So, but this one now, many people, as I told you, many people only think about this one until some years later, when some scientists they discover that okay, there is also, we have two types of circulation in the body, right? Larger circulation and lesser circulation.
Yeah.
Lesser circulation is called what? Okay, we have systemic circulation.
Yeah.
Which is this greater circulation, and then we have cardiopulmonary or pulmonary circulation.
Yes.
Which is lesser circulation. So now we measure this one because it is systemic. You can measure it from the body, systemic. But this one is pulmonary circulation. It means you have to check in the pulmonary before you can get it. And this one, there is no big veins that are. So the only thing you can do, the best way you can do, is to assess the vein.
Assess the vein.
Assess the high pressure through the vein.
But Mansur, we can use only this cassette for thrombosis also. I saw in the TV, or when clotting is there, something they send to blood vessel, open.
Yeah, it is a method to. It's also a method that you can use to break thrombi.
Thrombi, yeah.
I think
you wrote.
So it's also a method that you can use to break thrombi.
Indication for catheterization is called determination of the pulmonary blood pressure, especially of the case of the pulmonary hypertension.
Okay, so
but Mansur, for the treatment for thrombosis only, yeah. For treatment for thrombosis and for checking blood pressure.
Yeah, the veins through which the catheter can be introduced include femoral vein. Femoral vein. We have internal jugular vein, superior vena cava. These are the main veins that they use.
But Mansur, one more thing. Why we need to know to check pulmonary pressure? Why? What is the use of? For example, do you understand me?
The use of it is
You see, pulmonary hypertension, and it's only the way. There is no other way to check pulmonary hypertension.
yeah, it's the main way. It's the gold standard. But why do you think it's?
Why we need to know pulmonary hypertension?
Is it not important? Is it not important? Pulmonary hypertension can lead to pulmonary edema. Somebody suffering from pulmonary edema can die within few days. And so it is necessary for you to know it. If you don't know it, because you want to be lazy or something, you can kill the patient. The person can die within few days. If there is pulmonary hypertension that is staying for a long time, it is the main reason why somebody can develop pulmonary edema. And pulmonary edema can lead to sudden death.
But Mansour, in here, just tell you. But Mansour, in which situation we should do? For example, the patient is coming to you, you check blood. But is it possible, for example, the blood pressure is here, is normal? Do you understand me?
Like if we check the systemic circulation,
You see, it's normal.
arterial blood pressure.
Still, we need to know do this, or it is, huh?
I understand you. It is reasonable because you don't know it. It is like this. If patients, you will not see patients come to doctor and doctor will say, I want to check your pulmonary blood pressure. Where did you hear this before?
I didn't hear.
It is not possible. It is after this patient has come, you've diagnosed the person is having cough, the person is having cardiac asthma, the person is having a lot of different things, then you don't see what is wrong with this person. Then you need to know maybe the person has increased blood pressure in the pulmonary arteries. You need to check this, and then when this person has this, then you can start giving the person, because with time it's going to also lead to also cerebral edema, and then this one can lead to some kind of death of this person, because it's going to lead to compression of the brain and the person can die.
I mean, is it possible circular system blood pressure will be normal, and the person have pulmonary hypertension?
It will vary. In the case of somebody that is having systemic circulation being normal, and that is having, because it is specific for somebody that is having some symptoms. It's not just if somebody is having increased blood pressure, systemic circulation, it doesn't mean that this person is definitely going to have pulmonary hypertension. So it does not mean that. They are different. But with long time of hypertension can lead to hypertrophy of the left ventricle. When there is hypertrophy of left ventricle, there's going to be reduced ejection fraction. Left ventricle will not be able to contract very well because it is now big.
Yeah.
The blood because now it cannot beat very well. It means that it cannot push out blood out very well.
Aorta.
So now that is one. And
but
now,
why is affecting pulmonary vein, for example?
Be relaxed. Why are you in a hurry?
Okay.
So, and as it is now, it is not beating very well.
Yeah.
It will not be able to push out the blood out enough. And if you can remember, the first branch of aorta is what? First branch that aorta will give is what?
You give to which part of the body?
What branch? What
to
branch?
The right and left coronary artery.
Yes, right and left coronary artery is the first branch. So and you remember that these branches are the ones that are supplying the heart itself.
Yeah.
Now, two things are happening to one heart. It is big, it needs more blood.
Yeah.
But now it is weak, it cannot push out more blood.
Yes.
Now it is not getting enough blood. Now it is dying. Because it is dying, you know that from the right from the left atrium, blood is normally supposed to be coming to the left ventricle.
Left ventricle.
But now this left ventricle is not very strong. It cannot push all the blood to the aorta. It means some blood will still be remaining here.
Yes.
You understand?
Yeah.
And this one from the atrium, another blood will come from the atrium. It will still join this one, and then there will be more blood in this place. When it is now continuing to be like that, there will be blood up to here.
Yes.
But it means that this one will not be able to push blood to this place again.
Yes.
Is it not
there
like
will
that?
not be space. Yeah.
There will not be space. You remember that left atrium receives blood from where?
Left atrium. From lung.
From the lungs, through pulmonary veins.
Pulmonary veins.
But now this blood that it is receiving from pulmonary vein, they are not going to the ventricle again. This one will also become like this. It will fill up. Blood will go back into the pulmonary vein. If from pulmonary vein, blood will remain in the lungs. Because of this one, blood staying in the lung for a long time, there is going to be increased volume, increased fluid volume in the lungs, and then you are going to see increased capillary permeability, and then fluid from the blood will be going out from the blood vessels into the lungs, and we are going to have pulmonary edema. And so that is why I said somebody that is having hypertension in the beginning will not have any effect on the pulmonary blood pressure. But now, if it is taking long time and you start to see that this person is having cardiac asthma, the type of asthma that is not due to problem of the lung but problem of the heart. So in this case, you have to assess if this person is having pulmonary hypertension. If there is pulmonary hypertension, you can easily predict that, okay, it is because of the pulmonary hypertension this person is having a pulmonary edema, and this pulmonary edema is the reason why this person is having cardiac asthma.
But one more thing, for example, this blood, it will be in pulmonary vein, it will be accumulation, then it will go edema, it give edema to the vein.
You were not sleeping when I said, if you can reason it by yourself, if we say because there is problem here, it affects here. There is problem here, it affects vein. If there is problem with vein, it affects what?
Lung.
So it is reasonable. So blood that is coming from the lungs cannot go to the vein. Blood that is in the vein cannot go to the atrium. Blood that is in the atrium cannot go to the ventricle. So automatically everything goes back into the lungs.
To the lung.
And it is staying in the lung.
Why? So then why it will cause inflammation, edema? It will be swelling.
But I didn't talk about inflammation, right?
No, I mean about edema. Edema means a swelling, yes? Why it goes swelling, for example, if blood will be accumulating?
I don't understand your question.
For example, if the blood accumulation of the blood in the lung, blood will be accumulating. Why? It means edema means a swelling, yes? Why it cause edema?
Do you know nylon?
yeah.
Nylon.
Yeah, I know.
Okay, maybe I should show you one. So if lung is like this nylon, and you start to put water from here into it, what will happen to it? What do you not understand about how it becomes edema? That is why it becomes edematous. This kind of edema is not as a result of inflammation, but it is reasonable because with this blood is staying here for a long time. Small holes in blood vessels will allow water to pass, to come out from blood vessels into the lungs, and this water is going into the lungs. Small until they
cause swelling.
Yeah, then pulmonary edema develops.
It's for same thing. It causes pulmonary edema also. Yeah.
I just talk about pulmonary edema now.
Pulmonary means that venous of the lung. Yes. We have pulmonary vein. It cause pulmonary vein edema also. Yes.
I didn't talk about that actually.
It causes only of, what about it doesn't cause pulmonary vein edema? For example, this blood will be accumulated in the vein also because there will not be space here. I mean, from pulmonary vein,
But
it will be
Yunus,
staying there also.
Yunus, I understand that you are trying to imagine it, but let me give you a structure. Maybe you will understand it better. I will just okay. Let me just draw it here because of space. See, this is pulmonary veins,
Yes.
and now if blood in this place
Yes.
is not going as they should go,
Yeah.
blood remains here
Yes.
and all its branches.
Yes.
There are small holes, pores on the
Oh,
blood
hole.
face.
Hole, you mean?
Pores, yes.
Yeah.
Pores. How do I spell that pores? It's not pores like this, but pores like this.
Yeah, pores.
Small
Yeah.
holes.
In the blood vessel.
Water from here will be coming out because of the enlargement of these veins due to accumulation of blood in there. Then blood cells are bigger than water molecule. Water can drain. Water can drain from through these pores, and then as they are draining, they will be accumulating. They will be dropping here in the lungs.
In the lungs.
And then this thing can continue like this until the lungs becomes edematous, and the person will be having some kind of asthma. The person will not be able to breathe well. The person will have dyspnea. So now somebody that is having dyspnea, inspiratory dyspnea, you went to check this person before the x-ray, and then when you check x-ray, when you check the x-ray, you were able to find some water in the lungs. You don't, x-ray cannot tell you this water is due to inflammation. It cannot tell you it is due to left ventricular hypertrophy. It may not tell you that it is due to, although it can tell you, x-ray can tell you it is left ventricular hypertrophy, but it may not be able to tell you this left ventricular hypertrophy. Maybe it is due to long time standing hypertension, or maybe it is due to valvular disease, maybe aortic stenosis, maybe aortic regurgitation, maybe mitral valve stenosis, So it will not tell you. It is you that you are now going to carry out some tests to check, okay, what is actually happening. You understand what I'm saying?
Yes.
So as a part of your investigation, then we are going to examine the pulmonary blood pressure. When you find out the pulmonary blood pressure, you may want to drain out some of this water here, and you assess it, and you will check maybe in this water, maybe there are some inflammatory cell. Then you'll be able to say maybe it is due to pneumonia because of the inflammation.
Yes.
But if you don't find the inflammatory cell, 100% you can easily decide that it is due to accumulated congestion of blood in the lungs.
Yes.
You understand why?
Yeah.
And so it is your question that you ask. In the vein, blood is staying in the vein. Vein itself is in the lungs. It is not outside the lungs. We call it pulmonary vein. It should be inside the lungs. So these ones, they are in the lungs. So the blood that is staying in them, we make the water to drain and enter into the lungs and make the lung become bigger. And then it will become deep. This is not hypertrophy.
If it became big, is that edema also? How is it called if it became big? You say left ventricle hypertrophy for the heart, yes? That left ventricle became big, yeah?
Maybe it's because you don't know. I understand, but you cannot predict. You need to know. You should understand what is the difference between enlargement, edema, hypertrophy. Hypertrophy is enlargement of tissue, specifically parenchymatous tissue. Note it, parenchymatous tissue. And so if you are going to talk about hypertrophy, you can talk about heart, you can talk about muscle. It affects mainly muscle tissue. You can, in the case of lungs, you can talk about their edema, and the edema in them is going to be due to different reasons. In the lungs, it is difficult for you to hear edema, hypertrophy of the lungs. You can talk about enlargement of the lungs. You can talk about enlargement of the liver. You can talk about enlargement of the kidney. All these, they are parenchymatous. They enlarge, but they do not hypertrophy.
Only for muscle hypertrophy.
We can see only for muscle.
Okay.
Okay. And so this one, you should know, it is enlargement, and then and it is due to actually you know that the enlargement is not because the muscle tissue is overgrowth. You understand? Hypertrophy means like overgrowth, like that. But this one, it is not overgrowth. The cells are not increasing. Anything is not increasing. It is deflated because of water that is inside it.
Water, yes.
So
indications also, determination of the pulmonary blood pressure. Okay. So it means that this catheterization has two work, and we do as indication for this catheterization for thrombosis and to check pulmonary blood pressure.
Mainly.
Yeah.